have bulging discs, herniated discs in more than one disc. I have stenosis. I have scoliosis. I have stenosis. And I have through the MRI, I discovered I have a congenitally small spinal canal and lumbago. Snow and breaking up ice, because I'd always done that kind of stuff, never had any problems. And the next day, my back was kind of sore, and it kept getting progressively worse. And it finally reached the point where if I carried anything in my hands, I was in tremendous pain. And one night, went to bed, and I woke up in the middle of the night in unbelievable pain. Could not get comfortable, couldn't sit, stand, lay down, or anything. So I went down to the family room, and I went on our recliner, and apparently the pain kind of went away. And I woke up the next morning, and my entire right leg was paralyzed. And it scared the crap out of me. So I went to see an orthopedic doctor that we had been using in the family. He looked at me and said, I want you to see a neurosurgeon. So I made an appointment with a neurosurgeon, had an MRI done at that time, and they basically said, you need surgery. Well, through the course of events, the surgery was probably scheduled for about 3 weeks after this happened to get some pre-op stuff done and this and that. And I started gradually feeling a little bit better, still had numbness in my legs, still had some pain when I was standing or walking. Sitting, I wasn't in any pain. So I went to see the neurosurgeon. He scheduled surgery. He said, you've got a big mess back there. So I was literally in the hospital in a gown, and I had woke up that morning with a cold. And they debated for about 45 minutes and decided we're going to postpone the surgery till you're done. So I gradually started getting a little bit better, but I still always had the pain, always had the numbness. Went back to see the neurosurgeon, and probably the best thing that ever happened to me was the fact he said, you know what, we're not going to do surgery because you've made some good improvement. But the bad side of it was, he said, this could happen to you again in 3 weeks. This could happen to you again in a week. So I was like paranoid from that point on, never to do anything. And I lived the next 6.5 years of my life basically sitting down most of the time and standing only when I had to and faking it. And my husband and I had watched Dr. Jeff's infomercials in his show, and my husband would look at me and he says, you know, I really think you need to try this. Well, of course, you got to kind of build your courage up, because I was 6 years of this, figuring I'm not going to change. It is what it is. And finally, I just said, you know what, I'm still pretty young. I don't want to live like this anymore. And so I made an appointment, came in, and I was convinced from the moment I walked in, this was what I needed to do. And I think probably in the big scheme of things, I didn't realize what I couldn't do till I start doing them again. And that kind of thing, it even gives me goosebumps now to know how much I had given up. I mean, you don't realize over that time period, you know, you say, get your life back. You didn't even know you lost your life, you know. And just the whole approach that's taken, and, you know, you got to work hard, but they work hard right with you. And that's why I have been coming for 6 months, and will continue until somebody tells me I'm at my peak or where I need to be, and that hasn't happened yet, so here I am. Well, when I first came in, I probably had a pain level of a 3 to 4, simply because when I was sitting down, I was never in pain, but literally the minute I stood up, I was in pain. The minute I would take a step, I was in pain. Walking a block would kill me. I would do anything I could not to do that. And now I would say my pain's probably at a 1.5, and I actually have moments when I'm standing and walking that I'm not in any pain. And that's what I hold on to. I want to be normal. I want to live like a normal person. When you have to think in terms of every step you take, something other people take for granted, it's amazing. You have no idea. And like I said, I didn't even realize what I couldn't do before until I could start doing them again. I mean, I couldn't lay flat on my back. I can lay on my back now. I mean, there's a lot of things. When I first started with the treadmill, I had to hold on every step. And now it's like, I don't even want to, you know. So one of my goals was I want to be able to walk through an airport and not have to have a little cart take me someplace, you know, and I want to be able to do those kind of things. I have 2 sons who are grown, and I'd like to be able to play with my grandchildren when the time comes. I really like the staff and the environment here. I think the multidisciplinary approach where you're dealing with lots of different levels and you're not just getting one person's approach, you're getting a lot of approaches. I think that the staff is very positive. They don't focus on the negative, they focus on the positive improvements. And we've talked along the way, it's a series of baby steps. You don't just wake up one day and go, ta-da, I'm all better. It's those things you see, wow, I can do this. Or, you know, when you have any of the testings that are done and you see you've improved. I mean, that's all positive, and that's how the staff here approaches everything. You know, very positive, very, we can do this. It's not, well, you know, it's always on the positive. I tell them to come here all the time. I have people that, I think at work it's pretty fascinating because they can see the improvements. No one realized I was as tall as I was because I would walk all hunched over. I mean, and I joke around now because I'm not short. I'm, you know, 5'8.5", 5'9", but nobody knew it. So, and I don't lean, and people see that I don't walk with a lean. You know, so I tell people all the time, and I'm a walking advertisement. I mean, I tell people all the time. You're challenged here to the point, like I said, I was afraid to do anything because they, you know, they had the fear of me that this could happen again at any moment. You could have this happen again. So you literally don't do anything. You don't do anything that could potentially put you at risk to have that happen again. And here, you have that safe environment in which you do those things. And you do push yourself to do the things that you need to do to get better.